Our next speaker, James Stockson. He is, well, we had a talk before the show, and you were telling me about all the celebrities that you deal with. James has access to a lot of Hollywood celebrities, bands, so forth. He owns and operates Team Doctors Chiropractic Treatment and Training Center. He provides anti-aging consultation and care to numerous top celebrity entertainers. And James' topic today is elastic recoil mechanisms, how footwear accelerates the aging process. Help me welcome James Stockson. James?
Thank you very much. Well, I'm kind of shy, so I hope you can bear with me. I'm going to keep this short because I have a boxing match to go to, so it won't keep you very long. In fact, this is a videotape of a fight that was occurring last year, from which this gentleman suffered from a Achilles tendon tear, complete Achilles tendon tear, normally a career-ending injury. In fact, with these techniques that we use, we built him over the last 5 years to become the champion of the world. And in fact, tonight, at about 3 hours, he's fighting Eric Morales for the lightweight title. It's just down the street, about a mile, at the Allstate Arena. So what we can learn from athletes is a lot of very valuable information for anti-aging medicine to keep our patients healthier and active, because that's what's important in our practices. We're not practicing disease-based medicine anymore, because in anti-aging medicine and disease-based medicine are completely different. In the area of orthopedics, as a matter of fact, we talk about regional care, and regional care is if the back hurts, yeah, okay, we're going to treat the back, we're going to ultrasound the back, MRI scan the back, we're going to do surgery of the back and give this medication, and hopefully it reaches the back. However, in my practice, what we call, we use more of a kinematic chain type of care, which means that we're treating the entire structure of the body so that we can make the patient more active. This runs more along the lines of sports medicine care and performance-based treatment, and because we're trying to improve the performance of our patients so that they can have better cardiovascular output, get involved in activities. What good is it to increase the age of our clients when we don't allow them to do things in their later years? So in this lecture, you're going to hear a different kind of angle, which is going to be more about how to bring efficiency back to the body and increase the elasticity through elastic recoil mechanisms, and understanding how they work is going to give you a great insight on how to improve the efficiency of your patients. In my practice, when we employ these techniques, what we're finding out is that patients who are coming home tired at 8 and 9, they're completely exhausted from an average day, and they are sitting on the couch, or they're wanting to go to bed, and then of course they lay in bed, they have insomnia, and they can't go to sleep because their brain is functioning fine, but their body is just exhausted. What we're finding is that by restoring these elastic recoil mechanisms, we can add energy to their body within 2 to 3 weeks, and at 11 and 12 o'clock at night, they're ready to go dancing. So this is a very valuable tool that you can employ in your practice on Monday to improve the health and well-being of your patients. So what we're looking for here is to improve efficiency through these elastic recoil mechanisms. On top of that, when the body is vexed, what happens is that the body movement is no longer the same, it's no longer biomechanically sound, and as a result we have wear and tear and accelerated inflammation from these abnormal biomechanic mechanisms. And as a result of a poor diet, like the doctors talked about, metabolic syndrome X, as a matter of fact, if 65% of the adult population is overweight or obese, then we have extra load on the frame that vexes the elastic recoil mechanisms on top of this poor diet. So we have two forms of very damaging inflammation coming from multiple joint arthritis, as well as the inflammation that's coming from a poor diet. It creates a toxic soup for the patient. It's very damaging to the body, and creates a very quick acceleration of the aging process. And this graph right here is a graph that I designed about 10 years ago for my anti-aging practice or prevention practice. And what this graph does is it explains to the patient my anti-aging approach. This is not disease-based medicine. We don't treat you until the pain goes away. That's the old way of doing it. We're going to do it differently now because we're anti-aging doctors and we're concerned about their level of performance and how their life is going to be outside of just pain relief. In fact, in this first box, we see the red frame, which is the area of inflammation that they can feel. That's painful inflammation. That means that levels of inflammation of their body are high enough that they can actually feel frank pain. These are the area when they come to see you. I have pain in my foot, my back hurts, my knee's been chronically hurting, I have headaches or whatever they have orthopedically, and then you say, well, listen, we're going to embark upon this treatment program, but in fact, the second phase is when they decide that they're healthy. The absence of pain is good health, of course. I don't feel any pain, and then tomorrow we drop dead of a heart attack. Second phase, as we mentioned, is called the silent aging process, which means that inflammation is in the body, still toxic reaction to the cells, and the patient is unaware of the damaging effects of the inflammation because as disease-based medicine doctors, we didn't educate the patient on the damaging effects of this inflammation, both dietary as well as arthritic, and the patient just goes along thinking everything is okay. So if we measure the level of inflammation on the outset of the first visit, and we determine that level, and we say, this is a safe level, and we're going to focus more on this diagnostic test rather than how you feel, then I think that we're going to have better luck bringing them from the pain stage into a stage where we can bring them into an anti-aging lifestyle based on the levels of inflammation. So, once we retest them, when we feel we have sufficient amount of reduction of the abnormal wear and tear movement pattern, as well as we've got them on an anti-aging diet, then we retest them approximately at the beginning of maybe the 8th week. That's what we usually do. And then at that point, we hope that they enter the green phase, which is in fact where they're having an anti-aging lifestyle. They can go. They can do what they want to do without abnormal stress and strain, wear and tear in the body. Because if you have abnormal wear and tear as a result of a reduction in the elastic recoil mechanism, or abnormal biomechanics, every step that you take that is supposedly supposed to improve your cardiovascular condition is actually aging the body further or accelerating the aging process. Exercises that we are doing to try to reduce aging are in fact aging us faster. So people get frustrated and they just quit. As a matter of fact, 21 million people start an exercise program and decide to embark upon a running program, and within 1 year, 16 million of them have an injury that takes them out of running. So they have your patients have a 70% chance that if they embark upon a very nice cardiovascular running program, that they're actually going to be in pain rather than healthier after 1 year. When we're looking at elastic recoil mechanisms and body biomechanics, we're looking at actually the way the central nervous system controls the body. In fact, in this particular picture, we see a young lady who's on a balance beam. She's doing a routine which she couldn't do 10 years ago. But as a result of practice, and ingraining these nervous system patterns into her brain that control her body movements, then she can perform these acts of things that we can only dream of. And in fact, in this video, what I noticed was that she did some spring movements and flips, and those kind of movements demand elasticity of the body, which makes the body efficient. So when you're actually training an athlete, like we actually do in our office, I don't know what you do in your office, but in our office, we actually train athletes for competitions. It's a doctor's office, but we have a training center since 1991. Very proud of the fact that many world champions have come from this training center. And what we've noted is that we are looking at training the nervous system. We're not training the muscles and the joints. We're training the nervous system. In fact, if you understand how the system works based on patterns. These patterns are called engrams or neural networks. You have positive engrams and you have negative engrams. Positive engrams are those nervous system patterns that actually develop a movement pattern that is healthy for the body. It improves the bone density, it improves muscle tension or strength, coordination, agility, and those desirable effects that we're looking for in training, and the negative engrams of those training movements or movements of walking or running that are negative or create damaging effects on the body. Those are the movements that are creating inflammation and accelerating the aging process. And like I said before, not all of them cause pain. Movement patterns are divided into generalized and specific. Generalized movement patterns are those that we're born and then we develop them in childhood, the way we walk. I remember my father, who's in the audience today, used to evaluate children at the Shriners Hospital for crippled children. Mothers would bring their kids to our office and my father would watch them walk, and the parents were very concerned about their walking pattern. Maybe they had a little toe in or they had some difficulty that they noticed when they were walking, and these patterns are developed in childhood. My father would recommend to them that either A, they need to go to Shriners, or B, that they just are going to have to practice walking differently. In fact, when we tell a patient or we tell a child as a youth to practice walking differently, those are called specific movement patterns. For instance, if you have a poor golf swing and you are having a poor round of golf, you see a professional, they look at your pattern of movement through the golf swing and they make recommendations to change the movement pattern so you can have improved golf swing. It's no different in walking or running. So these mechanical patterns in walking, we have to evaluate them in our office if we're practicing true anti-aging medicine where we are actually integrating all aspects of anti-aging and prevention. We have to look at the way the people walk, because 10,000 steps a day are a lot of steps to create abnormal movement patterns. It's not difficult. All we have to do is put them in our office in a long hall. And in fact, here's one in my office here. And as you can see, whoop, I missed it. I'll have to go back. As you can see, in this video here, we're just walking down the hall, and I've become astute in determining where the stress points are in that patient's body by just having them walk. So, you know, maybe you're not really feeling like you can do it at this point because you haven't done it. But you can watch your friend's golf swing and you can see that he is not a good golfer. You can watch your son play football and notice some differences in the way he throws the ball or the way he runs, and you can make corrections. You can do the same thing in your office on Monday. When you start, as you learn, you become better. And pretty soon you can watch a patient walk, and they don't even have to fill out the forms on the history exam sheet. You can determine what's wrong with them by watching them walk. In fact, it's very shocking for a patient to put down that they have back pain, and I say, why didn't you tell me about the knee pain that you had on the left? Because I know you have it, and they look at me like I'm from outer space because they do have knee pain on the left. Why didn't you tell me about the chronic fatigue syndrome that you're suffering from? Because you didn't mark that on the sheet, because I notice it because of the laborious walking pattern that you have. So, in fact, if you are interested in becoming astute in biomechanics and becoming a more well-rounded anti-aging doctor, this is a very simple thing that you can do in your office. When does aging start? Aging started for those children when they walked in to be evaluated by my father and I. They were 5 and 6 years old. Aging of the frame occurs at all ages. Here we have an example of where we can look at the body from a more advanced method, which is really sometimes necessary if you're doing clinical research. However, in your own office, this is absolutely not necessary. You don't need any fancy equipment to do research on the body because you just need your eyes and knowledge. Now, we're going to look at the way athletes run, and in fact, sometimes aging and injuries can occur in obvious ways, as in this slide here, but sometimes this aging can occur in other subtle ways that we're not familiar with. Aging occurs without pain. We talked about that because aging occurs with inflammation. Inflammation doesn't have to be painful. We talked about that. It's silent inflammation. It's a silent killer. It attacks our cells and it causes damage to our arterial system, and we don't even know about it. So when we look at the body to determine where these abnormal biomechanics are originating from, we want to look at it as an engineer would. Why don't doctors look at the body like engineers? Engineers are the ones that are the most astute in looking at structures and how they move. Bioengineering, biomechanics, we look at most important area of the body is the foundation. The foundation is the foot and ankle area. Why should we look at the foundation? Because ankle sprains are the #1 injury in sports. So you can bet that all of your patients have had some sort of ankle sprain or damage to the foot. Why is another reason? 65% of the American population is overweight or obese. That added weight on their frame, as well as a lack of exercise, will cause damage to the foot and ankle and arches. The architecture of the arch is critical to the formation of all activities, including just simple walking. So, what we're going to talk about today is how we can change that. Here is the area of the foot that I'm going to look at with you. We're going to do just a simple 2-second review of the anatomy. As you can see from the left slide, that's the connective tissue, and the connective tissue is surrounded by the muscles and tendons. This is a word that I coined in 2002. This is called the supinator pronator cuff. It's like the rotator cuff, however, it's a cuff of muscles and tendons that have strategic attachments on the arch of the foot and maintain the foot in the proper balance between supination and pronation to allow the foot to land properly and transfer the weight of the body across the architecture of the foot, and the body weight then springs off in the foot and the toe off and allows the person to walk without extra wear and tear on the body. There are 160 scientific papers on subjects such as subtalar joint excessive movement and overpronation syndrome, and these tibialis posterior tendon dysfunction syndrome, and these different maladies that scientists and doctors talk about with the foot. There are about 80,000 articles on inflammation. And it's unfortunate that what I found in my practice, the majority of musculoskeletal inflammation comes as a result of overpronation of the foot. Well, that's a different topic altogether. There are reasons for that. As I mentioned to you, that the majority of the population is overweight. That means that there's a lot of extra load on the frame, as well as the fact that in order to stimulate these muscles, we must have activities that move the feet in the side-to-side direction, such as walking on multiple terrains and exercises with movements from side to side, turning and twisting movements to keep those muscles healthy that are attached at the strategic points of the arch. If you talk about orthotics, we can get into that subject now for a brief moment. If you understand that the arch of the foot is actually a suspension bridge, it is a suspension bridge that is maintained and kept elevated with the spring mechanism with the muscles that are above the foot, then you'll know and understand that to correct problems with the foot, such as collapsed arch or whatever you want to call it, arch problems, plantar fasciitis, and these heel spurs, that putting something under the arch is like putting a post under the San Francisco Bridge. It's absolutely it's not, in my opinion, and then this is a point of contention if you want to talk to me after the program, but if the arch is suspended from above by these muscles that attach on the arch area, then why are we putting something underneath it? The way to do it properly is not by, if we have a stomach that sticks out and weak abdomen, we don't put a girdle on our patients, we exercise them. So we're going to talk about how we exercise and we release this arch mechanism to allow the patient to come back to normal, because that's what we're looking for. Okay, in this particular view, we see that this is walking on the right and running on the left. And as you can see, if you look very carefully, the line shows the level of the arch. As you can see, as a matter of fact, the arch actually sinks deeper or depresses deeper in the running than it does in the walking. If you look carefully, you'll see that the arch of the foot actually descends approximately 1 centimeter further in running than it does in walking. And when the spring load mechanism of the arch actually loads deeper, 40% of the energy is stored, or is given off as heat, and the other 60% is stored to allow the foot to recoil. And this stored energy in the recoil mechanism, the foot can become vexed. The foot can become frozen, and that allows the patient to have to use more energy than they're used to. In this particular slide, what we're showing is neutral position in the center, and then supination and pronation. When you're walking, the body goes through supination and pronation movements as a part of normal walking. So if somebody says you pronate, that's normal. If they say you overpronate, that's different. What I call this, I coined this term, the safe range. The foot lands in supination, as in the right side, and the body absorbs the weight, the shock mechanism, through this supination to pronation movement during normal walking. So as we land in supination, the body weight is transferred to the foot, and then it rolls to neutral, and then a little bit of pronation, and then push off. It's a normal progressive movement through the foot. As you can see, if in fact this movement pattern goes outside the range, the safe range I call it, that's when we have abnormal stress and strain on the joints and abnormal wear and tear. As you can see in this particular slow motion video, you can see the foot is lower on the running, and this is when the muscles and the tendons that are from above the arch are actually stretched, and this elastic energy is absorbed in these stretching muscles, and then when you push off, they release their energy to allow the foot to move efficiently. If the arch of the foot is locked, which commonly happens, then what happens is then this stretching of the recoil mechanism muscles and tendons cannot occur, and the patient becomes extremely fatigued through their by the end of the day. And now you may be running blood tests, or you may be looking for some disease process when in fact it's much more simple. So when the body is actually landing, you can actually see with the naked eye in this video, if you can look at the difference between when the foot was planted and ready for recoil, the side of the foot, it looks very relaxed skin, and then you can see in this particular video where you can see the tendons coming through the skin. Those are the tibialis posterior tendons that actually emanate from the lateral aspect of the fibula, medial aspect of the fibula, and they cross over the back of the leg, and they cross through the underneath the medial malleolus like a pulley mechanism, and they attach as a three-prong attachment, like a goose's foot, right on the metatarsal cuneiform joint, which is the area where the arch must flex to be able to sustain the recoil mechanism. So in fact, feet are like bouncing balls. And when we're running, we feel sometimes when we're in a zone as if we're just gliding across the ground. I just had it today. I just felt great. Running was so easy. It's because the elastic recoil mechanism is intact. Some days you get up in the morning, you go running, and you feel like you're dead. And you just can't do it. And your body is achy, and you just can't run. And that's because your elastic recoil mechanism is not working, perhaps. All right, so 50% of the energy needed to accelerate the body and lift the center of mass of the foot is stored in the elastic recoil mechanism. Sometimes the patients will come and tell you, I'm tired and I'm in pain. I feel older than I really am. I just feel old. And so when they're telling you this, you may want to look at the lower body biomechanics to determine whether or not this is a source of their fatigue. What causes the arch to lose its spring mechanism? This is a graphic of the tibialis posterior muscle and tendon. As you can see from the graph, you can see that these tendons attach very strategically in the metatarsal cuneiform area. I don't know, a lot of doctors don't even know this muscle exists. In fact, it was interesting to me to find it as a young doctor because it wasn't in the bodybuilding magazines that I read before I became a doctor. And in fact, I thought it was very interesting that in the bodybuilding magazines and the fitness magazines that we had the same muscles exercise month after month in the magazine. And I said, well, according to Dr. Fisher, there are 602 muscles in the body, but these muscle and fitness magazines only show 32 or 33 of them. What happened to the other muscles? Or we're not exercising that. And what I found is that these other muscles are very important. And your patients are actually involved in exercise programs to make themselves look better, to make them look sexier, to make them look better. And in fact, if they don't embark on a training program that you prescribe for them that actually incorporates movement patterns that exercise a particular muscle, the tibialis posterior, what's going to happen is that they're going to break down and then their exercise program is over. Now they begin to age real quick. So what you have to do is when the patient comes to you, you have to say, look, bring your exercise routine to me so I can take a look at it to ensure the fact that it's balanced, that it's involving, it's protecting your foot and ankle, your foundation, it's got eccentric movements, and we're going to make sure that it's right for you so that you don't end up with lower limb extremity biomechanics like the one pictured here. Mechanical stress and strain up the leg, into the back, into the neck. No wonder these people aren't healing. No wonder they have to go to surgery for the herniated disc. Did you ever realize that herniated disc, when you have them, a lot of them heal up without care? Why do some heal up and why do some don't? What I found in my practice is that the ones that have failed the physical therapy programs and the other chiropractic and medical programs that embarked upon some strategic way of getting rid of the back problem, herniated disc, knee pain, or whatever it was, the one most important missing component of their program was they completely ignored the other floors that were beneath the spine, such as the hip, knee, foot, and ankle. They were completely left out of the examination. Why do I know this? Because I asked the patient. Did they examine your foot? Did they ask you to walk down the hallway? Do you want to be the doctor that makes the mistake by forgetting or leaving out that portion of the exam and end up having your patient be in my office and me bringing those things out? I doubt that. So on Monday, when you have patients with lower back pain and inflammation that does not go away, then you need to take a look at those floors beneath the body, beneath the spine rather, to determine whether you've missed something. Because if you don't, what's going to happen is that they're going to say, well, I'm going to go to Dr. Walgreens because obviously this doctor is not helping me, or I'm going to go here or try this different one, and they're going to end up, or they're just going to quit and give up and say, well, I guess this is a pain I'm going to have to live with, and that's certainly not anti-aging medicine. Because it's a constant and chronic release of inflammation that causes a toxic effect on the body and damaging. Not only that, but can they outlive the wear and tear that's occurring on their joints, leading to a joint replacement surgery? I don't know if you'd all want to have, any one of you would like to have a doctor walk in the room and say, I'm sorry, there's nothing I can do for you. We're going to have to replace the hip socket with an artificial hip. Well, your patients certainly don't want it either. So what we have to do is we have to do what's necessary for our patients when they're in their 20s and their 30s. If they're wearing footwear that's not good for their body, we have to make them aware of it. And if they laugh and they say, well, I have to wear these shoes and so forth, you don't laugh with them. You reiterate to them the importance of lower extremity biomechanics and how it creates inflammation, and they want to look sexy, but this inflammation actually ages them faster, and they wonder why they're not feeling good in their 40s. Lack of elastic recoil also affects the hip area and makes that area weak. The spinal biomechanics are thrown off. The swivel mechanism of the spine is disrupted. So how are we going to correct it? How is this weakness corrected? First of all, we are in an age where we are actually in a very high-tech and flat world environment. All those fun areas where we used to go up the hill and down and get an ice cream cone, they're all been taken away. We have escalators, we have elevators, we have flat surfaces such as sidewalks and streets. So as a result, you're getting out of bed and you walk through the hallway of your home, you get in the car, there's no exercise to your body except pushing the accelerator and the brake pedal. You get out of the car, you walk up to your building, and you walk down the hall, and you have no exercise to the areas that are balancing your elastic recoil mechanism of your arch. So as a result, your arch is collapsing because it's weak. You gain some weight, makes it worse. Some muscle exercises we call functional exercises. Those exercises actually bring function back to the body. That's what we're going to describe today. We have dysfunctional exercise, which actually cause more stress and strain on the body, wear and tear. Because the patient doesn't understand the technique, they need to be schooled. That's different. Or exercises that are just a waste of time. How many of you can think of a sport where you're sitting down kicking something? There's no sport where you're sitting down kicking anything. This particular exercise can be weighed as is it effective or is it not effective. This is called a single joint exercise here for the calf. It makes it look very beautiful, but by itself will cause tremendous damage to the foot because it only works the foot in one particular direction and it does not work the foot in supination and pronation, which is the most important component. We didn't have to worry about that before because we would walk and we would go into the countryside when we were farmers and we worked in the farm and worked in the fields. But now life has changed. We don't have those movement patterns that actually maintain a solid arch because we're too busy. We're mostly on the sidewalk or we're mostly running on the treadmill. A lady asked me, "You mean I can't run on my treadmill?" And I said, "Well, you certainly have to do more than that." Can you hear me? Okay. So to help balance the foot, we have to do these exercises that actually balance the foot area. Now, as you can see in this particular picture, this is a normal foot on the left. It's not very sexy, but that's normal. On the right is a baby's foot. So as you can see, an adult and baby's foot look the same. How many of you folks, your feet look like that? The toes are sprayed and there's a nice landing strip for the body's weight to land on. That's the normal presentation of the foot. As a result of putting on shoes over years of time, shoes actually deform the foot. In fact, if you put a shoe on a baby's foot, it begins deforming their foot at age 1. This is the deformity of the foot that is a physical deformity that will cause abnormal movement pattern in the rest of the frame as a result of abnormal biomechanics. So, physical deformities have been around for thousands of years as a result of binding of the foot. This is a most extreme example of binding of the foot that occurred for 1,000 years in China. It was acceptable to bind the feet. 10% of these children did not live through the procedure. They died. That was to make you look attractive. We have our own modern foot binding. It's called shoes now. Foot binding creates weakness in the foot. Yet, we decide that we're going to put our gym shoes on, or our shoes to exercise. And heaven forbid that you take your shoe off and you exercise barefoot in the health club because it's unsanitary. Or could you imagine you took your shoe off to exercise in the health club? I had a patient of mine. She actually told me, she's in the back, Cindy, right? Isn't this example what happened? She said, "Can I come back and exercise with you because the health club won't let me take my shoe off to exercise my foot?" And I said, "Absolutely." And she's been going with us for another 2 years. Exercising with shoes causes the foot to become weak. The foot drops, the arch drops and locks. The arch is suspended from above by these muscles, and the muscles have to be exercised. So here we have the question. Should we train with footwear or should we take our shoes off? Is it dangerous to run with their shoes off? As children, we ran around and never had a problem. Why is it as adults it's forbidden? It's ridiculous to think that training without shoes is dangerous. In fact, a couple of athletes won gold medals. Here's one particular one. There's a book called Running Barefoot. I did not write it. I have nothing to do with it. It's the story of this athlete who won the Olympic Games in 1960. He ran the marathon and won the gold medal and broke the world record wearing barefoot the entire 26 miles. He's the only athlete in marathon history to repeat the feat again in 1964. He won, and after he won, he did a series of calisthenics waiting for the other runners to come across the finish line. He beat them so bad. Why are the African runners so good? Why do they beat us in all the marathons? Is it because they're from Africa? That's ridiculous. It's because they can't afford shoes, and they run barefoot to the school, and they run back home for lunch, and they run barefoot back to the school, and they run home for lunch 20 miles a day. How do I know this? Because I interviewed them. I studied them. I analyzed their training. I know what they did. They ran without shoes because they couldn't afford the fancy running shoes. So what I recommend to our patients for anti-aging medicine is running barefoot or exercising with barefoot sports such as martial arts and stretching of the foot. Here's a particular stretch that is done. You can teach your patients how to do it. Patients pay me a lot of money to stretch their feet like this. It's absolutely unnecessary for me to stretch their feet. You can teach them how to do that. Each individual toe must be stretched in order to allow the foot to release its elasticity for movements that are necessary from side to side. Why is it that the lady who reaches for something in the cupboard, she loses her balance and she falls and breaks her hip? Because she doesn't do that movement very often. So I don't get up on a balance beam very often either. But if I do it regularly, then I'll be able to do the balance beam movements. What I'm saying is that your patients probably don't do movements like this. And that's why when they do movements like that, they don't have the engrams necessary in their memory banks of their central nervous system to have balance and coordination during this movement pattern, and they fall. You see? As doctors, sometimes we limit our patients and we cause more damage to them than we do them good. Oh, don't run, it's bad for you, don't do this, don't do that, when in fact we need to work very hard at bringing movement patterns back, bringing them back to the activities that they used to love and having them become more active. Here's an anti-bunion stretch. Some of the ladies would like this one. Is it possible to stretch the toe to prevent bunions? Of course it is, and you should do it. Because if you're set on wearing high heel shoes and shoes that damage your feet, then do the maintenance in the evening when you get home to prevent these damaging effects from occurring. Neuromas, pinched nerves in the foot that cause damage to the nerves, that you can do neuroma stretch. And here are some exercises that we devised in our office for working the foot in eversion. Just put a cuff around the foot, and we exercise the foot in inversion. In fact, this is being performed by one of the dance instructors in the back, who's a client of mine. And she was able to avoid having a hip operation as a result of the exercises that we prescribed for her. And it was nice to receive the cookies that you brought for the gift was very nice. She did not have to have the hip operation. You can avoid these operations by rebuilding the structure either by hand or with exercise or both. My practice, what I do in my office is I physically rebuild your body by hand, your arch mechanism, rebuild the elastic recoil back into your body to allow your body to become more efficient. Here are some exercises that we do when we have an ankle sprain. Why? We do it because we want to strengthen the ankle. And then when your ankle feels good, we stop doing them. Wrong. The athlete that has won the world championship, we didn't do that with him. Because it's important in boxing to have strength and power in the feet. And it's also important for your patients. So, when we look at why people have injuries from running, we're looking at something very simple. And we don't really realize that. In fact, I've never seen an article about this, but if you go to your office and you sit down like you're sitting now, there's absolutely no stress being put on your joints of the lower extremity. So that means that your body's not getting stronger. The way your body gets stronger is by putting stress on it. Then the muscles develop in the evening with the growth hormone, and then we develop stronger frame, and then we are able to do more activities. In this particular chart, I'm showing that walking causes 1 to 2 times the body weight is imparted upon the musculoskeletal structures to increase the strength from exercise. But if we're sitting in our chair at the office and then we decide, well, we're going to go running, we've decided that if we weigh 120 pounds, which most women in the audience I know weigh about 110, but if we weigh 110, we put 5 times the body weight, that's 550 pounds of pressure on our feet. If all we're doing is sitting down at the office doing computer work and all of a sudden we get out putting our running shoes on and we put on 550 pounds of pressure on our body, then we're going to cause damage. We have to graduate into that with jogging, light jogging, and then running. This is a cytoskeletal protein that is what scientists feel that gives the body the elasticity. It's called the titin protein. And I coined a word, or I've heard a word called titin tuning. I like it. It's a great word because what we're going to do is we're going to use the elastic recoil mechanism to tune this titin protein through what we call eccentric foundation training, something that we developed. We're going to increase elasticity through this titin protein by training it and tuning it. If you tell patients don't do this and don't do that, then they're going to become less elastic and they're going to lose function and they're going to have more inflammation and you're actually causing them to age faster than by having them do activities. Here's where we did a study of an athlete who was running with toe out. This causes damage to the foot and the arch mechanism, and this, in fact, we improved his running style. Here's where we use titin tuning to improve the strength of the actual recoil mechanism muscles that I showed you on the graph, the pronator, supinator cuff. By moving side to side, we are able to tune those muscles through eversion, adduction, abduction, pronation, and supination muscles to balance out the foot. And in fact, it's so easy. Just set up a course where they run in a circle, and that is as easy as it can get. In fact, you can do a figure 8 where they can get both movements in, and it's very easy to do in their backyard. And this can help them to avoid sarcopenia. With eccentric training, sarcopenia was reduced faster than weight training. Eccentric training is better for the patient than weight training. And in fact, this study was done on patients over 70 years of age. So hopscotch is something that is very simple, can also reduce osteopenia. And the number one cause of death in the American population over the age of 65 is from falls. Because once they fall, their mortality rate is much higher. Here are some other eccentric training that we do. These are very simple. And in fact, like I told you, I didn't want to keep you too long because I have a boxing match to go to, but I want to go over this last slide here where I'm talking about this orthotics, or these things that we put underneath our foot to fix our suspensory structure, which is our arch, which in fact is not the route to do. In fact, it's better to have the patient do exercises that actually build the eccentric component of the of the foot and ankle area in a balanced way to allow the arch to be suspended on its own, so you don't have to wear any of these orthotics. Allow the patient to get stronger. And in fact, I want to end my topic. I hope that you learned something by stretching and by eccentric movements to help to restore your patients to near perfect function. And I'd like to end by telling you to live your life like a champion every day. Try to develop champions in your practice through your patients, and support the anti-aging movement. Thank you very much for inviting me.